Welcome from Ottawa, Canada's capital, and thank you for participating in today's webinar. My name is Dr. Bob Bell, Director of our undergraduate curriculum and Associate Professor in the Department of Medicine at the University of Ottawa. It is my pleasure to welcome and to introduce today's presenter, Dr. Claire Touchie, Associate Professor of Medicine, University of Ottawa, and Chief Medical Education Advisor with the Medical Council of Canada. We would like to thank Dr. Touchie for taking the time today for her presentation. Dr. Touchie.
Thank you very much, Dr. Bell. I'd also like to thank the University of Ottawa for allowing us to do this. This presentation is not only presented here live, but it's also a webinar across the country and around the world. So for those of you who are getting ready to take your exam, doesn't matter where you are, you can participate in this webinar. So this is really designed for the final year students who will be taking the exam in 2018. So if any of you are taking the exam this fall in October of 2017, you can probably turn off your devices, or you can leave the room because this isn't applicable to you. So what are we going to do this morning? I'm going to give you a bit of a talk and some background for about 20 minutes, and then we'll have 20 minutes for a Q&A. So we'll do the Q&A here in the room, and we don't have mics for the Q&A, so what I would ask for you to do on site is just scream out your question. And for those of you who are online and who have joined us from across the country, please make sure that you use the tool that is available to you to ask questions, and we'll be alternating between live questions and a question on the tool. For those of you who are here that will ask the question, I'll repeat the question, and for those of you online, I'll also read your question to make sure that everyone has heard the questions. If we don't have time to get to your questions, don't fret. You can actually go on our website. You can go on mccevolution.ca, and you can ask questions there, and those questions will be sent to our communications department, and we'll be able to answer the questions at a distance. And those questions, if we don't already have them answered, will be put on our facts sheets so that you can be well informed. So welcome everybody, and we'll get started. I just need to make sure that this can move forward. There we go. So what are we going to do? We're going to talk about a number of things. So why does the MCC exam exist? Why do I need to have my LMCC? Why is this exam changing, and especially for you, for the first time takers, why am I the first people to have to take this exam? What's the new examination blueprint? What are the components and what are the exam weightings? I'm going to try and address some of your concerns about taking a new exam, and we'll talk about exam preparation and tools. We'll talk about pass-fail decision and scoring and what you should expect. So what is the Medical Council of Canada, and why does this organization exist? So the Medical Council of Canada was born out of the rationale concern for patient safety and developing a credential to enable physician mobility. So Sir Thomas Roddick that you see there on the picture was an MP in the federal parliament, and he was also a physician. He was a professor at McGill University. And he was very concerned because if you were a physician, for example, if you were a physician in Gatineau, and you were having supper in Ottawa and somebody got sick in Ottawa, you can actually be imprisoned for looking at after the patient. So somebody choked in the dining room where you were having supper and you extended your aid, that was illegal. So that was a problem. The other thing that was going on was that education wasn't standardized, and so you had charlatans around and people who were causing harm. So he lobbied starting in the early 1890s to have a standard credential. And in 1912, there was an act of parliament that was decreed, and MCC was born. The first exam was given in 1913, and I actually have that exam, and you wouldn't want to take it. It was unbelievably difficult. So it is a national qualification in medicine that would be acceptable to all provinces, and that's why you take the exam. Why do I need the LMCC? Well, the LMCC is actually a necessity for you to get your license to practice. It is one of 4 components to practice. What is the LMCC itself? The LMCC is 3 components. It's the Part 1 exam that you'll be taking in the spring, the Part 2 exam that you'll be taking 12 to 18 months approximately after you finish medical school, and you need to have 12 months of postgraduate training. So once you have all of those parts, you get the LMCC. And the LMCC, along with your certification exam, your postgraduate training, and your certificate from your medical school, will allow you to be eligible for licensure. So why is the exam changing? The exam has had essentially the same blueprint for approximately 25 years. Whenever you have exams of this nature that are national and that are incredibly high stakes for students, you want to make sure that it actually reflects practice. So you want to make sure that what's required of physicians for safe and effective care is reflected in that exam. So you don't want to test stuff that's no longer relevant. So in 2013, we undertook an exercise called a practice analysis. And this practice analysis led to 4 major research endeavors. And we gathered 12 experts from across the country, so people from your faculties, to come and advise us as to what the blueprint should look like. They spent 3 days with us, did all kinds of exercises, and proposed a new way for us to frame the exam, which is what we call a blueprint. So this blueprint has 2 main dimensions, what we call the dimensions of care and what we call physician activities. So the dimensions of care are 4 different dimensions. So health promotion and illness prevention, acute care, chronic care, and psychosocial aspects of care. The physician activities, you'll see, they kind of make sense. We assess, diagnose, we manage, we communicate, and we hopefully act professionally. So that is how we're going to frame the exam. That's how we assemble the exam and put it together, is using those different components based on classification of items. So what are the different components of MCC Part 1, and what are you going to be doing when you come to your exam in the spring? So the first thing is that you'll need to select a language to begin the exam in. So the exam is given in French or in English. But you'll need to pick whether you do it in French or in English at the beginning of the exam, and the exam will remain in that language for the length of the exam. It has 2 parts. It's computer-based. The first part is multiple choice. It's about 4 hours. There's 210 multiple choice items on there. 175 of them count towards your score, and 35 of them will be what we call pilot items. And that's a single best choice of 5 different choices. So you pick your single best answer. In the afternoon, you'll do 3.5 hours of what we call clinical decision making, and there'll be 35 cases. Each case is 1 to 4 questions, and you do either write-in, so you actually have to type in your answer, or short menus where you have a list and you choose within the different list of answers. 30 of those will count towards your score, and 5 of them will be pilots. The exam will be a single sort of continuous exam, so you'll actually be able to flag a question that you either don't want to challenge at that point in time during the exam, or you're finding it difficult and you want to skip it and come back. So you can do that. You can flag question number 1, you can do your 210, and you can come back to question number 1. Same thing with the clinical decision cases. We used to have sections, and those sections have now disappeared. So this is what we call the content weighting. So this is what the exam is going to look like. So if we look at physician activities to start with, approximately 45% of the exam will be based on assessment diagnosis, about 35% will be around management, and around 20% will be around communication and professional behaviors. On the other side, so these have been approved by our exam board. On dimensions of care, what was proposed was that approximately 20% be on health promotion and illness prevention, approximately 35% on acute care, 30% on chronic care, and about 15% on psychosocial care. We had a lot of discussion with the various deans across the medical schools, the undergraduate deans, and what they suggested as we transition over this is that 15% actually be for health promotion and illness prevention as the schools beef up their programs and curricula, and that we keep about 40% in acute care. So this is what your exam is going to look like when you think of proportions of what you need to study. But I'm really concerned about taking a new exam. So this is a new exam, and we talk about it as a new exam. But all the questions have been pre-tested. So these are not new questions to us. In fact, most of the questions are on our exams right now. Okay? So these are questions we have not thrown out the exam bank and started all from new. The people who are taking the exam in October, some of those questions will be on your exam in the spring as well. So we're using the same bank, we've expanded it a bit, and the new questions have all been piloted. So they've all been tried out, and they've all been deemed to be acceptable to be on this exam. The questions that are being piloted on your exam, so I told you there were 35 multiple choice questions that are on your exam and 5 CDM cases. Those will be piloted, but they will not count towards your score. Right? They're being pre-tested for next year and the year thereafter. So essentially what this means is that the content on the exam is extremely similar to the content on the previous exams. It's a new way for us to assemble it, and it's a new way for us to report on it. So the people who are most unhappy are actually your undergrad deans, because they have to figure out how this plays for them in their curriculum. But from a point of view of somebody taking the exam in October and somebody taking the exam in April, the exams will look similar, they will just be assembled a different way and reported on a different way. So how should you prepare? So study using the resources that the other years have used to study. If it's the same types of question, you can use the same resources. So your class notes, your textbooks, your school review courses that your schools put on for you. Okay? Other things that you can use the MCC objectives. So we have a new website that I'll talk a little bit about that was just launched today. So beware, there are some glitches. But the MCC objectives have been revamped and have been reconfigured a little bit to make it easier for you to manipulate through them. You can also use the Toronto notes as a guide. I know I used them when I was in school, and they are a guide. They are not your sole research, study tool. We also have practice tests, which I'll talk a little bit more about. So how can you use the blueprint to study? So you can actually help using the framework to help with your studying. So for example, if you take diabetes mellitus and you were to take diabetes and you look at dimensions of care and you look at physician activities, you can already start structuring your study. So you can think of diabetes, so how do we prevent diabetes? How do we prevent the secondary manifestations of diabetes? What are the things I need to put into place for that? What's the acute care issues with diabetes? How do I treat the new patient with diabetes? How do I treat diabetic ketoacidosis? How do I diagnose it? Chronic care would be the ongoing care of diabetes and all the psychosocial aspects of care that are related to diabetes. And you can do that as you study your different topics. So that'll help you structure the study in terms of this blueprint. So what are the tools that we have available to you to study? We have a website called mccevolution.ca. And on that, there are videos, testimonials. There's actually a resident from University of Ottawa that talks about how he prepared for the examinations. There's also discussion about the new structure and there's more details about the new blueprint if you're interested. I would urge you to go to the MCC Objectives site that's found at mcc.ca, and you can peruse that just to see if you've got, you've touched base on the topics that we expect you to know. There's also some practice tests that we're developing. 3 of them will be available as of January 2018. That will be the MCQ forms. You can buy those for a small sum, small in my view, but maybe not for yours. It's $100 for approximately for each practice test. And these are questions that are developed exactly the same way as we develop our questions for the large exam. You can also stay informed as to changes that are occurring. You can go to mccevolution.ca/resources/news. So for example, this webinar will be posted there. So if some of your classmates are wondering about this, you can send them to our website so that they can be kept up to date. We also have facts and FAQs and videos that you can access on the same website. And just going under FAQs. And like I said, all the questions that will be generated from this session will, if they're not already on our FAQs, will be put on our FAQs. Does everybody get the same exam? Nope. So there are multiple forms for the exams. So, but the exams, each form is designed in such a way that the level of difficulty for each of the forms are the same. So whether you're taking Form A or Form B or Form C, you're not seeing the same questions, but it's designed in such a way that the level of difficulty is the same. And each of these forms is actually reviewed by a committee. The committee is made up from national experts from various schools across the country that approve the content. So they actually look at it, they make sure that it's targeted at the right level and that it's targeted for students at the expected level of graduation. Big question that we get all the time is pass-fail decisions and reporting of scores. So how do we decide on a pass score? We do an exercise called a standard setting exercise, and that's done with a group of clinicians. We bring them in, and they actually look at the exam, and they do a psychometric exercise where they decide where the pass score should be set. And we have multiple of those groups, and then we put things together. So it's criterion-based. So theoretically, every one of you should be able to pass the exam. We do not do what's called norm referencing. We do not have a predetermined number of fails. Okay? So every one of you, if you meet the criterion, will pass the exam. The standard setting this time, because it's a new exam, we do the standard setting, what we call post-priority. So we will do it after the exam so that we can actually use exam data to support this exercise. So that means that your marks will be delayed a little bit by approximately 2 or 3 weeks. Can this new exam fail a large percentage of candidates? Because it's a new exam, are we gonna fail 25% of students? That is unbelievably unlikely. Okay? So from my experience of doing this for 20 years now, usually the exam will fail between 1.5 to 7% of students. And it is not based on what we decide, it is based on the cohorts and how you perform. Okay? How are your scores going to be reported? When will I know my score? So it'll be sometime at late June or early July that you'll get your score for this spring session. And how are the scores reported? Well, it's not a percentage. So you're not going to get 75%, 80%. It's actually what we call a standard score. And through your account, you'll receive a final mark, and it'll say whether you pass or fail, and it'll give you your standard score. The standard score is a range. They have, in the psychometricians in our shop have not yet decided the range that it will be. We'll know by early this year, early in 2018. But you'll also receive a supplemental information report, which will be an extra report that will tell you how you did in the different aspects of the blueprint. Okay, so it'll tell you where you've been strong and where you've been a little bit weaker. And with that, I'm going to wish you all the best on the preparation of your exams, but I'll open it up to questions. So just as a reminder for the questions, I'll take questions from the people online, and I'll take questions from the people who are here in Ottawa. If you're asking a question from Ottawa, please make sure that you speak clearly and loudly, and I'll repeat the question before I answer. So I will open it up to questions.
Sorry,
Yes.
sorry if this was, I came in a little bit late, I was at another meeting, but do the questions change in difficulty like they have in the past, based on how you get them right or not? Sorry.
So the question is whether or not the questions change in difficulty as they did in the past. So presently our exam is what we call a computer adaptive exam, which means that you take a series of 4 questions and then in a topic, and then in the next topic, the next round you get this topic, the questions can be harder or easier. So no, this will no longer occur. We will have what are called fixed forms that are set at a certain level of difficulty, and all the forms have that same level of difficulty. So you'll have some easy questions and some hard questions on your exam, but the exams are predetermined. Okay? Other questions? I'm taking a look online. I'm not seeing any questions right now. Any other questions in the audience? Yeah?
Yeah. When we challenge a question, is it locked in immediately, or can we go back and change it during the exam?
So the question is whether or not when you answer a question, if it's locked in immediately, or if you can change it during the exam. My understanding is that when you press the submit button at the end of the exam is when the exam will be submitted. So you will. One of the questions from away is MCC being changed for IMGs. So for 2018, the MCC is not being changed. So for the upcoming year, it's staying the same as it is, and the MCC Part 1, the QE Part 1, is being given as usual for Canadian students and for those who have passed the EE. The MCC will be changing in 2019. So in January 2019, the MCC will no longer be a prerequisite for IMGs. They will be challenging the Part 1, and Part 1 will be available internationally. I'll take a question here, and then I'll go back to the questions from away.
My question's about the date of the exam. When can we book our exam?
Oh, great question. So the question is, when can they book your exam? Just watch your inbox. You will get a notice to register for the exam, which will be this fall. The exams will be given, it's usually in the latter part of April, first part of May. So usually last 2 weeks of April. First week of May is when the exams are given. You will choose a preferred date, and then you will be assigned a date that you go for your sitting. And it's based on your school right now, because it will be given this year, will be given in the school still. So you'll be given a time. Lisa?
I just wanted to add to that, if you go to mcc.ca and look under the MCC Part 1 exam, on that main page, there's a table that has the different exam
I'll
sessions.
repeat that for away.
Yeah, exam sessions and then registration periods, so and fees, all that kind of stuff. So all of that information is there just for future sessions as well.
So this was one of our communication experts, Lisa, was telling the folks here that for registration for your exam, you can go on mcc.ca and look under the Part 1 exam. You will find a table with the different registration dates, the cost of your exam, with the fees, and when the exam will be given. I will take a question from away. So someone asked, when taking the practice exam, will we have an opportunity to flag questions? Yes, absolutely. You will have an opportunity to flag question at any time, and you can go back to it at any time during your 4-hour period or your 3.5-hour period. Question here again. And we'll go to the next question. Is the exam still specialty-based? Questions on family medicine, question on internal medicine, etc. The questions will be assembled by the blueprint, like I showed you, that 4x4 table. But the questions are still based in your contexts of medicine. The questions are created through the objectives. So our item creators pick an objective and they write a question based on an objective. So for example, a question on abdominal pain could have been created by a pediatrician, could have been created by a surgeon, could have been created by an obstetric gynecologist or an internist or a family doctor. So you'll have different slants on a question on abdominal pain. It could be that it's a problem in pregnancy, it could be that it's a kid with appendicitis, or it could be somebody who's got Crohn's disease. So you need to look at it from that perspective. Other questions in the audience? Yeah? At the back?
Just as a follow-up to that, so I think previously, from what I understand, it was weighted equally for each specialty, and that was explicitly done, so obstetrics was weighted equally to internal medicine. Is that still the case, or that's not considered?
So the question is whether or not the questions will be weighted equally by discipline as we have it now. So right now we have 28 questions from medicine, 28 questions from surgery, et cetera, et cetera. The answer is no, but I'll put a caveat to that. So in the past, they were set that way, but if you go to our objectives does not say that a specific objectives belongs to a specific specialty. So for example, if you had a question on pulmonary emboli, that question could come from the surgeons writing it, or it could come from the internist writing it, or it could come from the obstetrician gynecologist writing it. So even though we had those divisions, they were slightly artificial. So as a test writer, you could not know if it was coming from medicine, surgery, or OB sometimes. So it was just a way for us to assemble the exam, and now it's just a different way of assembling the exam. I'll go to the next question here. Does the final score affect our chances for a residency spot as IMG, or it's just a pass-fail score? So this is a slightly different question. So right now, the EE exam is a prerequisite to enter residency, and until the new MCC Part 1 International becomes the prerequisite, it is still your EE score that will be a prerequisite to residency. Once the exam goes international, then yes, your Part 1 score is going to be important for entry into residency, since it will be a prerequisite for IMGs. So Emily is asking, so if we understand properly, we may get our results after we have started our residency. So yeah, that is correct. So for those of you, most of you in Canada, your results are not necessary for you to enter residency. So you will write your MCC exams, and it doesn't matter actually if you will need to pass the exam to get your LMCC, but most schools do not make it a prerequisite for you to get your MD degree. There are a couple of schools in Canada that does make it a prerequisite, and we are working very closely with those schools for a contingency plan for 2018. So you will get your scores most likely a few days into residency for this iteration of the exam. Other questions here? Okay, we'll go down. So is there any question bank that we can get online that is close to exam MCQs? So so online per se, we do have some examples that are available on our site, but the biggest bang for the buck is to get the practice exams. The practice exams are, Lisa, am I correct saying 100 questions on those practice exams? 100 questions, and those questions are designed by committee members like we have for the real exam, and they are designed exactly the same way. In fact, those questions were piloted by the class before you. They were piloted by the class of 2017 to make sure that they meet our standards. So these are questions that would look very similar to what is going on. There's a question back here.
Yeah, is Ottawa one of those schools that you were
Okay, so the question was, is Ottawa one of those schools that require their marks to graduate? Is that it? No. The schools know very well which schools they are, so you are not one of them. The two schools that do require the MCC to graduate are Laval, no, actually not Laval anymore, Sherbrooke and Université Montréal. So those are the two schools. Somebody is asking if it's going to be the same exam form for the international medical graduates. So when we go live in 2019, so that's not for 2018, but when we go live international for 2019, the exams will be the same for the IMGs as for the Canadians. So whether you're taking your exam in Adelaide, Australia, or in somewhere in the Middle East, or you are taking your exam here in Ottawa, you will get the same different forms. So there's not forms created for one population or the other. It is the same exam. And I see that my colleagues at MCC are confirming. So they confirm that the answers are saved only when the exam is submitted. So you can change your exams in your 4 hours. You can go back and forth as much as you want. You can change your answers for both the morning and the afternoon session. So once you press your submit button at noon, when you're done your exam, or whatever time it is you're finished your exam, that's when the answers will be submitted to MCC, and then you won't be able to change them. So one of the questions, what about USMGs? The USMGs, if you take the Part 1, it's the same kind of exam as the Canadian MGs, the Canadian medical graduates. So the exam, the Part 1, is the same for everyone around the world. So if you come and take it, whether you're an IMG, US medical grad, or Canadian medical grad, the Part 1 is the same for everyone. Any other questions here? Yes, at the back there.
When we sign up for the exam, can we choose a city and also a test center location?
So right now, the exams are still school-based. So that means that your schools are hosting the exams in the exam centers. In 2019, you'll be able to choose your site. I do believe, and I'll probably get an answer through here, I do believe that, for example, if you've already moved, you can probably ask for an exception. But usually, if you're from University of Ottawa, you take a seat most often at University of Ottawa. Okay. And I think I've already answered that. Okay, so what happens if you do fail? So that's a great question. What happens if you do fail? You take it again. So you have, as of January 2018, you will have 4 chances to take your exams. So you can fail it 3 times, at which point and you can take it at the next exam session. So if you fail in April, you can then take it in the fall. As of January 2019, we will be giving the exam in 2019, we'll be giving the exam 4 times during the year. And as of 2020, we'll be giving it 5 times. So it'll be easier for you to take your exam again should you fail. Or, for example, if something happens and you cannot, for whatever, if it's health reasons or something happens within your family and you cannot make the April session, then you take the exam again. So if you fail, you do get a failure in your file, but you can take it again. And the licensing authorities and the people who are, if you're submitting your file, will know your latest score. So they will know your past score. Okay. Questions here in the audience? Maybe getting to answer all the questions. In the questions in the afternoon, will there be multiple choice questions that require more than one correct answer? So when you do clinical decision-making questions, when you have those short menus or the multiple choices, yes, there can be more than one correct answer. You will usually be asked very clearly to state whether or not we want you to give 2 answers or 3 answers or 4 answers. There are occasions when only one of those will count, depending on how the station is or the question is set up, or sometimes it will be up to 2 or 3 correct answers. So it is, if we're asking you what are the things that you would do now, sometimes there are multiple things that you will do at the same time, and those questions allow us to test for that. Questions in the audience? No, we're getting pretty quiet here. So one of the questions is previous part 1 had 7 sections. Has this changed for October exam? No, October 2017 is exactly the same as the last number of years. Only the spring 2018 exam will be changed and go to fixed form, which is not in sections. It will be one big exam that you can scroll through. Okay, other questions? We've already addressed that. So the question is, so this again goes back to the CDMs in the afternoon. All the multiple choice questions in the morning are single best answer. You just answer one question. There is just one single best answer, and you will only be prompted to answer one. So if you try and answer one and then you try to answer a second, it'll flip. So you won't be able to answer 2 correct answers for that one. In the afternoon with the short menus, you will be prompted as to how many answers you should provide, and you should be able to provide that. In the past, we used to have choose as many as appropriate. That would be incredibly unusual nowadays to see that. You might see that on occasion throughout your exam, at which point you have to do your best, your most appropriate during the exam. So just like you would order blood tests, we'll ask you to order what you think is correct, as opposed to target shooting and ordering everything. We have another one here who is asking, my question is about the process of standardization. How do you standardize the crude score, and what is the criteria for passing cutoff point? Standardizing the crude score, this is getting into the weeds a little bit. This is getting into psychometrics. The exam is based on what's called an IRT model, or an item response theory model. That means that each question has a certain weight on the exam, and the pass score is based on meeting a certain level. So the crude score, for example, getting 70% is just not the way that we do things. It really is at the level of the mass of the questions together. So it's what we call a compensatory exam. So if you do really badly in one section, it'll compensate. And you do really well on another section, the section you did really well on will compensate for the section you did really poorly on. So there's no having to pass one section or not. And it is not based on a crude score. It really is based on what we call an IRT score, which is then translated into a standard score, which a standard score is just more understandable to us. Because if I gave you a score of minus 0.32, you would not be very happy. Nobody would understand that. I'm going to take one more question. Any questions in the audience? One last question. Okay, we'll go one last question here. Will it be possible to take both Part 1 and Part 2 abroad after 2019, and in which countries? Part 1 will be available at 500 different testing sites in 80 different countries, but Part 2 will only be available in Canada at our 18 present sites. So with that, no worries for those who didn't get their questions addressed. Those questions have all been recorded and will be looked over. And we will add any of the new questions to our fact sheets if they've not already been answered previously. And with that, I am going to wish you all the best in your preparation for your exams. Should you have any other questions, don't hesitate to communicate with us through our website. We'd be happy to answer and help you prepare for your exams. And with that, I will thank everyone for having attended today.